Hi guys, this is Dr. Phil with Total Performance Physical Therapy, here talking to you again. Today we're going to talk about piriformis syndrome. What is piriformis syndrome? It's that pain you get in your butt that sometimes gets misdiagnosed as low back pain, hip pain, sometimes sciatica. I'm going to talk to you about what exactly it is, what's going on, and what we can do on our own to help alleviate the pain you have in there. So let's go over some simple anatomy first. So piriformis syndrome involves your butt and your glutes and everything in here. Not necessarily the glutes, but it happens underneath your glutes. So if you would peel the big glute muscles away, you're going to see deep inside the anatomy of the hip. So you have your hip bone here, your femur, your sacrum, and then the tissues we're talking about is going to be your piriformis muscle and your sciatic nerve. So basically what happens with piriformis syndrome is the piriformis can get tight, it can bind down and cause pressure and compress the sciatic nerve, which actually passes underneath it going down the leg. And what can happen is nerves don't like pressure, they don't like tension, they don't like any kind of outside influence on it. They get irritated, and what can happen is when you have pressure or irritation on the sciatic nerve here, it'll cause symptoms that go down the leg, which a lot of times why people think, oh, it's sciatica, oh, it's this or it's that. So what we want to do to help alleviate that pain that you're having in the butt is to alleviate the pressure on the nerve. So how do we do that? Well, there's a couple things we can do. First, we can get a foam roll. So the reason why we want a foam roll first is we want to get those soft tissue restrictions, those muscle knots, out of the muscle. So this works really well. And look at this thing. Look at how nasty this thing is. It has bumps in it. This is going to get nice and deep into that muscle tissue. So what you'll do is you'll place it on the ground. Let's say it's my right butt, and if you're looking at me, this is a vision. This picture here was a view from the back of your right hip. So you're going to put your right buttock right on top of that foam roll, and you're going to go right to the spot. Oh, there it is. And you'll know it when you hit it, if you have piriformis syndrome. And you're just going to roll back and forth, relieving that pressure, finding that spot, relieving the tension in that piriformis. Right in there for me. I don't have it, but I can feel where it would be hitting it. And I would recommend going back and forth 10 times, taking a break, and then coming back again and going another 10 times. If you've never foam rolled before, it can be pretty intense, especially with one like this. That's really, really digging in deep. You may want to start with a flat foam roll first, if that is too intense for you. So after foam rolling, the next thing we'll do is just a simple piriformis stretch. You'll be on your back, pulling your knee up. If it's in your right buttock, you're going to pull your right knee to your opposite shoulder, and you will feel that stretch deep in your butt, and you know you're getting your piriformis. And I would hold that for 30 seconds, and then I'll relax, and I would repeat that 3 times. So that's piriformis syndrome in a nutshell. Again, real quick, you have the piriformis that goes from your femur across the hip, attaches to the sacrum. It's that muscle that does external rotation movements of the leg. It happens because you have tightness in the piriformis, it compresses the sciatic nerve, so we want to relieve the tension, and we did that with foam rolling and with stretching. So I hope that answers any questions. Hopefully if you have piriformis or similar symptoms, this will help you. If you find that it doesn't, come see us at Total Performance Physical Therapy. I'm Dr. Phil. Have a great day.